Hi, everyone. My name is David Natanov. I'm a first-year medical student at Robert Wood Johnson. I'm here to talk to you all today about how we can assess COVID-19 outcomes and mortality using deep learning methods. So the scene in front of you is from a hospital in Lombardy in Italy during the start of the pandemic, where doctors were forced to make heartbreaking decisions regarding which patients they would put on ventilators and which they would simply leave to their own devices. Now, this central problem of resource allocation is central to COVID, and it's only getting worse with the advent of a bunch of really useful but limited quantities of these monoclonal antibodies, as well as different other life-saving medications, as well as rising case counts in the United States. To deal with this problem of resource allocation, I propose COMA, which is a neural net / machine learning framework for predicting COVID-19 outcomes based off of available data. And I think it's unique because it simultaneously uses radiographic and lab biomarker data, which not many other algorithms that are built for a similar purpose do. And what I'm actually going to do is use a bunch of pre-built resources and open source databases together in order to pool them together to make a tool more rapidly and using more experimentally verified methods right away. The research questions I want to answer is, can COMA be able to predict COVID-19 outcomes at a rate better than physicians? Can these biomarkers that I generate be useful for identifying different targets for molecular biology research, particularly drug targets? And can COMA help optimize resource allocation in scarce settings? So let's start with CT images. I'm going to use something called AtlasNet, which is a 3D medical imaging convolutional neural net combined with a set of data housed at Stanford to identify different interesting features about these CT scans. Now, this method has already been done, and the details of which are on a paper. And from that, we can generate a bunch of really interesting features about these scans, including these ground glass opacities. Now, combined with that, I want to take a bunch of non-radiographic biomarkers, which includes everything from demographic information to different blood and urine biomarkers to comorbidities to their genetic background, using a set of data from the GoBiome database. Now, with these two sets of data, I want to combine them and generate a bunch of risk metrics for these people using machine learning methods. Essentially, when a patient comes into the clinic, I want a doctor to be able to punch in their information in their scan into this tool and get a risk assessment. How likely is this patient to die right away? What's their course of illness going to look like? And how severe is it going to be? Now, there's a lot of challenges in order to deal with this properly. There's the problem of combining these two different data sets together, as well as finagling with different algorithmic parameters, as well as also just getting doctors to do this in the first place. But I'm confident with enough hard work, I can get it to work and make COMA a useful triage tool for clinicians. And with that, are there any questions?